So if it has ever crossed your mind that you are tired of bedside nursing and really want to do something else, which is still nursing related, you are not on your own, because there are so many nurses who wake up every single morning and they wish that they were not going to work as a bedside nurse. I've done a bit of research and I've compiled a few nursing specialties that you can do even as an overseas nurse and you can get sponsorship for. So if you are tired of bedside nursing and you're really thinking of doing something else that is still nursing related that you can get sponsorship for, this is the video for you. Guys, you are welcome to my channel. I'm so excited. I'm always excited to stand in front of the camera, to share useful information with you. So I've done a bit of research and I've compiled a few nursing specialties or nursing jobs in the UK that you can do even as an overseas nurse, yes, and you can get sponsorship for. So I know how it feels like coming to the UK with all the excitement. I'm going to the UK to work as a nurse, and then one day you wake up and you feel like, oh my god, I'm so exhausted. Honestly, if you've not been here, you may not really understand what I'm saying, but being on your feet to work for 12 hours, it can be so exhausting, even to the point where even if you feel like you've had one whole week annual leave, waking up to go to do that one long shift alone, kind of puts you off, let me put it that way. So it's fine, as humans, for you to feel that way sometimes. It doesn't mean you should get stuck at the bedside. It doesn't mean that there's nothing else out there for you. Sometimes when we come from overseas, we are kind of limited to being at the bedside and we feel like we don't deserve any other opportunity. Also, sometimes you feel like we don't know what is out there. We don't know what other nursing specialties or nursing opportunities that is out there for us that we can grab. So I'm here to share with you non-bedside nursing jobs that you can do here in the UK. So without talking so much, let's get right into this. The first one is community nursing. So I know people who are working as community nurses. We used to work in the same ward, but now they are working as community nurses. So if you're not here in the UK, you might be wondering what community nurses. So in the ward, when patients are discharged, they go home, some of them with long-term catheter, they go home with diabetic wounds that needs to be dressed at home. So obviously the patient cannot stay in the ward until the wound heals, or if a patient needs to have a long-term catheter in, they would have to go home with the catheter. So somebody needs to go to their homes to do the catheter care. Somebody needs to go to their houses to do wound dressing. Somebody might be a diabetic and may need their blood sugar monitored. They may need insulin administration and all that. So once you are discharged, you are not just left to go home on your own. That's one thing I love about the UK system. They make sure you are being looked after when you go home. So before a patient is discharged, for instance, if the patient is diabetic, they will do a referral to the community nursing team to let them know that this patient is being discharged, he's diabetic and will need support while he or she is home. So the responsibility of the community nurse is to go home and continue the care. So the bedside nurses will do their part whilst the patient is in the ward, and it's the responsibility of community nurses to also do the continuity of care from home. So whatever it is that the nurses will do for the patient in the ward or in the hospital, the community nurses will also do it whilst they go home. It is not as stressful as being on the ward, being on your feet, constantly doing medication, 7-bedpan commode, that kind of thing, because you go to the patients out, they look after themselves. You only go there to do what you're expected to do. The good thing is you can get sponsorship for this, and you need to be a driver. You need to have a driving license because you'll be driving from house to house. So what you need to do is to get a driving license. So if you're an overseas nurse yet to migrate to the UK and you think, oh, this is something I might be interested in, try working on your driving license as soon as you get here, so that in case you see any opportunity, you grab it, and definitely you get sponsorship for this community nurse job I'm talking about. The next non-bedside nursing job you can think of is vaccination nurse or immunization nurse. So as an immunization nurse here in the UK, what you will be doing is to be part of the mass immunization programs for children. We've got the childhood immunization programs that we do. Even back home we used to have it, like the measles, MMR, polio, HPV, influenza, you know, that was those kind of child immunizations. And also we've got the annual flu immunizations, because here in the UK during winter there is always the outbreak of flu because of the weather. So being an immunization nurse, this is something that you might be doing. So if you have any interest in immunization, you could also look out for something like this if you kind of thinking of leaving the bedside. Also with this pandemic, there is this COVID vaccination ongoing. Most hospitals are running it permanently, and this is something you can also consider. So with this job, you definitely get sponsorship for, because most NHS hospitals advertise these jobs. So for this job you might be based in the immunization department, or even in the maternity department, helping with immunization of babies, children, and even pregnant women, because they have like routine immunizations that they give to pregnant women as well. So if this is something that you could be interested in, you can try and then start looking out for such jobs. Now let's talk about research nursing. So one thing I've realized in UK, they are always doing research. They are always doing research, and that is how come they are so developed. They have treatment for almost everything. So if you go to a oncology department, you realize that they are doing so many research. If you go to COVID department, they are doing COVID research. If you go to diabetic clinics, they are doing diabetic research. So there's research going on everywhere. The importance of research is it brings out solutions to problems. So if we don't research into it, we will not know the problem, we will not know the solution. So the next non-bedside nursing job is research nurse. So if you are someone who is really interested in research, this might be the opportunity for you, because one thing I've realized in UK, they are always doing research, health related research. Even when they are trying out a new medicine, they do research. You know, with this COVID, they have COVID research. If you go to oncology department, they would have like ongoing research. Sometimes if they want to try out a new medicine for cancer patients, they will definitely recruit cancer patients to try them on, and they will definitely need the help of nurses to help with observations and everything. If you go to like renal department, they will definitely be trying out new medicines for patients with renal conditions. So there is research ongoing everywhere that you can actually get involved in. So if you have any interest in research at all, it would even be an opportunity for you to like get to meet experts in other fields that you may not even know. So you can get sponsorship for this job as well as an overseeing it. So you don't really need to think, oh, I may not be qualified for this. No, don't think about that at all. So go online, search for research nursing jobs, and always target the ones that are providing sponsorship. So if you're interested at all in this area, so go online and start looking for nursing research jobs, and it will surprise you how many nursing jobs that you would come across. Another non-bedside nursing job you can think of is being an outpatient nurse. So being an outpatient nurse, what you would do is you not work in the ward. You know how it is at the outpatient. So most people come in with appointments to see the consultant, to see the doctor, to see the nurse specialist, and they prescribe treatment for them, or they arrange to have them like have some procedures and all that. So what you might do as an outpatient nurse, as you might be doing some health education, you might be doing observations, you might monitor patients' blood pressure, height, you know, when they come in, even before they go to see the doctor, there is an assessment that you need to do. So honestly, this is not really as stressful as being on the ward. Like I said, 7 medications to patient, morning, afternoon, evening, and all that. And sometimes the working hours for outpatients would normally be between like 8 o'clock and 6 o'clock. You know, each trust is different, but these are the regular working hours sometimes for outpatient nurses. So if this is something that you could be interested in, try looking into it and start looking for job opportunities for outpatient nurse. The next one I'm going to talk about is practice development nurse. So if you're already here in the UK, you have definitely heard of practice development nurse. So in the trust I work in, what the practice development nurses do is they used to train overseas nurses for their OSCE. They take them through all the practical training sessions that you need to be able to prepare you well enough to go and take your OSCE. So the practice development nurses, they also do train people on like basic nursing skills like cannulation, venipunctures, in taking blood sample, how to care for stomach bag. Sometimes if there is any new machine or any new procedure they want nurses to learn. They will be the ones to actually get trained first, and then they come to the ward to train other nurses. So it's like being a practice development nurse, you are always on top of your skills. You can definitely get sponsorship for practice development nurse, because I know an overseas nurse who is working in a hospital in Kent. She came as an overseas nurse just like you and me. She passed the OSCE. After working in the ward for a while, she branched into practice development nurse because she saw an advertisement on their trust website. She just went in ahead, applied, and she got the job. So do not limit yourself to your ward alone. Just think outside the box. And if you think you might be interested in something like this, the moment you see any practice development nurse job being advertised, just apply for it, and you definitely get sponsorship for it. Another non-bedside job you can think of is public health nurse. So there are 3 branches in public health nurse. They have occupational health nurse, health visitor, and they also have school nurse. So for a school nurse, what they normally do is they go into schools like primary schools, secondary schools, to give them health education. They go to also do school immunization, for the childhood immunizations I mentioned earlier on. And occupational health nurses, they are also normally based in the hospitals, and normally if there's anybody being recruited, they would have to like go through that health screening and all that. So the occupational health nurse, they are the ones who do that. And also if somebody stays home and is off sick for any number of months, normally the manager of your ward will refer you to the occupational health nurse, so that they will give you some advice on how to return to work. They give you that full support on how to make you or help you work effectively. So what they basically do is they are like concerned about your health and well-being. So it's more like an office job, 9 to 5. Sometimes they are also involved in the yearly rollout of flu immunizations in hospitals for nurses. So it's not something that you cannot do at all. So you just have to make the inquiries in your trust as to how you can get such opportunities. The other branch, health visitor. So health visitors, what they normally do is, for instance, the little I know is if someone is pregnant, they look after the health and well-being of anybody who is pregnant. I remember I had a friend who told me that a health visitor came to a house just to check if the environment is okay enough for her to enjoy the pregnancy and all that. So even whilst you're home, health visitors are thinking of you as you're pregnant. Another thing the health visitors do is they go to your house especially for someone who has just delivered a baby. They help you with they help support you on how to do like exclusive breastfeeding. If you are finding it difficult breastfeeding your baby, they teach you all of this. So the public health nurse, they are concerned about the general health of the public. So this is what you might be doing if you go into public health. It's either any of these 3, and also for this one you have to register on another part of the NMC. So as an adult nurse, you already have your NMC pin. So if you want to do public health nurse, you'd have to, after going through the training for any of these 3 that I've mentioned, you have to like do your second registration on the NMC register. So you would have 2 registrations as an adult nurse and as a public health nurse. So that is what basically public health nurses do. So if you see any vacancy like a health visitor, school nurse, occupational health nurse, those are all branches of public health nurse that you could also consider if any of these is of interest to you. The next one is infection control nurse. So I always go by what I've seen, what I've experienced, being on the ward. So normally the infection control nurse, what they do is if there is an outbreak of maybe diarrhea, maybe for a whole bay full of patients, like 3 out of the 4 patients are having diarrhea and they don't know where it's coming from. Whenever there is that outbreak, definitely the infection control nurse needs to be called, and they will come and show you the infection control precautions that you should put in place to avoid the spread of that infection. So if there's any new policy or infection control policy, infection control guidelines from Public Health England, the infection control nurses will be the first people to know, and they will come to the ward and to other departments within the hospital to disseminate this information. Sometimes you also see them like posting like flyers and posters in the walls about any new like infection control protocol. So even with this pandemic, whenever there is any new thing regarding what to do to avoid the spread. They would be the one to disseminate the information. So it's all about infection control, preventing infection, everything about infection prevention. That is what they do. They normally work between 9 to 5. It's more like office hours jobs. They do go to the wards as well, and also they are also responsible for like anything that has to do with pressure damage, avoiding pressure sore in the ward. They do quite a lot. They have a lot of stuff that they do in the infection control. So if this is something that you could be interested in, start looking around, talking to the infection control nurse just to get more information on what they actually do. And this is a job that you definitely get sponsorship for, because mostly these jobs are advertised by NHS Trust, and they normally will give sponsorship, especially even if you're already here. So the last one is disability assessor nurse. Someone might be wondering what this is and what they do. So a disability assessor is a medical professional who impartially or thoroughly assesses the personal situations of those with a disability to see if they qualify for PIP. They ensure that those requiring help and assistance from the government are able to receive it and play a key role in the health system. So this assessor job, what you would do as a nurse assessor is that, or as a disability assessor, is, you know, there are so many people here in the UK who may have suffered from like long-term disability, so they are on government benefit, and at some point somebody will have to assess them to ensure that they still qualify to like receive government benefit and all that. So there is like a thorough clinical assessment that you, the nurse assessor, would have to do. You write a detailed report on it and all of that. So one interesting thing about this, you can work from home. You can definitely work from home, so it's really, really good. And I came across one disability nurse assessor job, and they were actually offering sponsorship for it. I even posted it on my community tab, so whoever came across it, I believe that they definitely stated tier 2 sponsorship. You know, some for this particular job, for the ones I've mentioned, they all give sponsorship. For this particular one, you don't normally see them advertising that with sponsorship, but for the job I came across as the nurse assessor, they were giving sponsorship for. So if you're interested in this and looking at the fact that you can even work from home, you can start looking into it, reading more about what they do and how to even land yourself those jobs. Sometimes it can be a bit frustrating, you know, doing something that you've lost interest in. It can be so frustrating mentally, physically, and everything. It affects you in every way. So start exploring some of these non-bedside nursing jobs I've just mentioned, and start reading around it just to see where you might get that interest, and then start applying for jobs around that. So if any one of you is looking to apply for a new job that is outside the bedside, I wish you the very best of luck. And if there is anything that I did not mention, if there's any non-bedside nursing job that I did not mention, please put it in the comment section so that others will also get to know of the other opportunities that are out there for us, especially those from overseas. So if you've enjoyed this video, please share with others, because there are people who do not even know of these non-bedside nursing jobs that I've mentioned, so that we can all learn. So see you in another video, and take care. Bye bye.